guys, how are you? Dr. Aman Arora from Arora Medical Education. I get a lot of questions regularly from trainees about the RCA, and in particular, which cases you need to be submitting. Of course, guidance came out for the November 20 version of RCA going forward in terms of what are mandatory cases that you need to put in as part of your 13. So we're going to go through those mandatory cases in this video, and also going to talk about how to get 10% off our two main RCA courses, our live virtual RCA immersion course and our RCA 90 online course. I'll talk about that in a second. But let's go through the mandatory cases that you need to submit as part of your collection. Number one, you must have a minimum of one case involving a child, so someone less than or equal to the age of 16. And the case could be by proxy, so it could be someone you're seeing about that child, but the case has got to focus on the impact on the child itself. So minimum one for a child. Number two, a minimum of one case of an older adult, so someone aged over 65. It could be a variety of different presentations. It could be multimorbidity, it could be polypharmacy, it could be social issues, but it's got to be at least one of an older adult. Then you have 4 clinical areas that you need to have at least one case representing. Number one, at least one of an acute problem, so something that needs some kind of urgent management. It could be admission, it could be something urgent that needs to be arranged on that day, but it's got to be an acute problem that you're seeing. Number two, at least one involving maternal or reproductive health. So think about seeing someone antenatally or problems within pregnancy, for example. At least one with a mental health concern, depression, anxiety. We see a lot in general practice when it comes to mental health, and at least one case must be of a long-term condition, something like cancer, multimorbidity, disability, for example, something that you can demonstrate has been going on for a while to show impact and how you manage those types of things. And this is important, at least 2 of your cases have got to have an examination component, either actually doing an examination if it's a face-to-face scenario, or explaining examination and rationale if it's telephone or if it's a video consultation. Of course, a lot of you guys are doing those right now in terms of your working style. So at least a minimum of 1 child scenario, 1 older adult, 4 clinical key areas: acute problem, maternal or reproductive, mental health concern, or long-term condition, and I should say long-term condition, and then at least 2 cases involving some kind of examination. Those are mandatory. There are a couple of recommended as well. You should be having a widespread across clinical topics, so you don't want too many in cardiology, respiratory. At least I'd say no more than 2 in each clinical topic. Ideally, if you do 1, if they're all different, but at least a maximum of 2 per clinical topic. And also, amongst all of this stuff, you need to be having a variety of complexity as well. So make sure when you're choosing your 13, you don't just choose a variety in terms of clinical topics and areas, you choose a variety in terms of complexity that can demonstrate your skills as a GP to be. Right, 10% off 2 of our courses then. So we have 2 different things for RCA, and people go on one or the other, sometimes both, depending on the way they need help best. So our main virtual live RCA immersion course is based on role playing and feedback, where we talk about how to manage each one of your 10 minutes, how to get the most out of your day-to-day consultations, how to deal with those classic challenging things like multiple agenda scenarios in a really time constraint point of view, how to improve time management, how to improve efficiency, and how to make sure things like a 2 or 3 minute management plan can demonstrate lots of skills that are being looked at in things like the RCA. So that's our main virtual RCA immersion course. There are different dates for that you can book onto. And then there's our RCA 90 online course, which is a subscription course for 1, 3, 6, or 12 months. And I break down 90 really common day-to-day general practice presentations and talk about how can you utilize the data gathering, interpersonal, and clinical management aspects of these common things to make sure you're boosting as many marks as you can when it comes to RCA, and we teach about them regardless of whether you're doing telephone, video, or face-to-face. So 10% off any of these 2, use the code AuroraVideo10. Go to the website auroramedicaleducation.co.uk. The code is AuroraVideo10, ARORAVIDEO10, and you'll get 10% off either the virtual RCA immersion course or the RCA 90 online course. But remember, the mandatory things that you must be doing in terms of RCA, in terms of your case submission: at least 1 case of a child, at least 1 case of an older adult, at least 1 case in 4 clinical areas: acute problem, maternal and reproductive health, mental health concern, and a long-term condition, and then at least 2 demonstrating some kind of examination. We do a lot of work on this in terms of the online course, the virtual RCA course, teaching how to get these things across, even if you're doing telephone or video consultation. I really hope this helps. Hashtag CanPass will pass. Hashtag I went with Aurora. Hopefully we'll see you on the live course. If not, hopefully you can make use of the RCA 90 online course. Take care.